I'm Dr. Michaels with the Reconstructive Foot and Ankle Institute, and today we're going to talk about Sever's disease. Sever's disease is also called calcaneal apophysitis, and the calcaneus is the heel bone, and there is a growth plate on the back of the heel bone right in this area. And sometimes in young children, usually 9 to 11 years old, that play soccer or very active sports, this growth plate back here becomes inflamed, and that causes heel pain. So your child will complain that there is pain in the heel and they have trouble walking, especially if they're playing the football or the soccer. And so what they usually end up doing is just suffering and having pain and having an inability to run and walk. So we usually see them after they've had this problem for 2 to 4 weeks, and we see them and we can quickly diagnose this problem and treat it very effectively. Oftentimes it requires a little bit of rest and kind of backing off the sports, but we want to get you back to doing what you want to do, as soon as possible. So in an effort to do that, we provide something like this. This is called a custom orthotic device, and it's made to go on the foot. As you can see, it fits the foot quite nicely. And oftentimes what we'll do is we'll put a little bit of a lift on the bottom of the heel to lift up the heel, because the Achilles tendon attaches right where that growth plate is, right back here. And so if this Achilles tendon is always pulling up when you're running or playing football or soccer, then that's going to put stress on the growth plate. And so if we can support the foot with an orthotic and put a lift on the heel to lift up the heel and take pressure off the Achilles tendon, then the inflammation in the calcaneal growth plate will go away, and then the pain will go away, and then they can get back to doing what they want to do. So basically, heel pain in a child is usually on the back of the heel, not on the bottom of the heel. And so in this case, it would be inflammation essentially of the growth plate in the heel, and you have to take out the inflammation to get the pain to go away. And the easiest way to do that is not through pills or anything like that, but it's through a device that's custom made for the child's foot, and it goes inside the shoe and it lifts up the heel and supports the arch of the foot, and that way the growth plate can rest and the Achilles tendon doesn't pull so hard, and the inflammation in the growth plate goes away and the pain goes away. And that's Sever's disease.